Avinash Bhakta. I'm an assistant professor at the University of Kentucky Markey Cancer Center. I'm a colorectal surgeon. I wasn't one of those kids that was born thinking that he was going to do medicine. My parents were immigrants from India, and we ran a motel, so we kind of grew up cleaning bathrooms, renting rooms, talking to a lot of people, kind of the business and the hospitality side of things as well. And so it kind of was understood that I probably would just kind of inherit that or kind of work in that. And then it wasn't until kind of college where I started volunteering at some hospitals and learning kind of the humanitarian side of healthcare that I got interested in medicine. And so at that point, a lot of my friends were going into medicine as well, and so I kind of joined them in that track. So I trained in an environment where minimally invasive surgery was one of the things that I learned quite a bit, and so my expertise is mostly in minimally invasive, laparoscopic, and robotic surgery for bigger cancers. And not only cancers for benign diseases such as diverticulitis, inflammatory bowel disease, and also pelvic floor disorders as well. Definitely a huge attraction to Kentucky was the state and the city reminded me quite a bit of the town that I grew up in, which is what I always consider home. It was a small town in rural Nevada, a military town, and kind of our nearest Walmart was 72 miles from where we lived, and you kind of rely on the people that you live with to kind of get through everything. It's a small town feeling. The big attraction here was that I could treat my patients like I would treat my neighbors or my own family. And I think that's what my patients really appreciate when they see me, is that I wouldn't necessarily recommend something to them that I wouldn't recommend to my own brother, sister, mother, father. I treat a lot of patients from Eastern Appalachian Kentucky, and I have a good outreach program with the physicians in Pikeville, in Prestonsburg, in Salyersville, in Harlan, kind of in Somerset, Corbin, or you name it. And I kind of got to know the country, got to know the state as well. Although the surgery is done by myself, I sometimes outreach to those physicians out there for chemotherapy, for other types of other treatment modalities. And if we weren't in an academic setting, we kind of wouldn't necessarily have that helping hand out there. Probably the thing that I always tell my wife about when I go home is when a patient truly gets cured and kind of gets better, but they also give me thank you cards, which is what I appreciate, and that's kind of what I have at home. And when you're having a hard day, any type of rough day, it's kind of what I go to, what I look at. Those cards are what kind of get me through and keep me going.